What is the difference between free testosterone versus total testosterone versus bioavailable testosterone? Free testosterone is the testosterone that is not bound to any proteins in the blood. Free testosterone is the most biologically active form of testosterone, meaning that it can bind to cell receptors and exert its effects. Total testosterone is the total amount of testosterone in the blood, both free and bound to proteins. Total testosterone is measured by a blood test. The difference between free testosterone, total testosterone, and bioavailable testosterone is important because free testosterone is the most biologically active form of testosterone. If a person has low free testosterone levels, even though their total testosterone levels are normal, they may still experience symptoms of low testosterone, such as decreased libido, erectile dysfunction, and fatigue. SHBG levels can affect the levels of free testosterone, total testosterone, and bioavailable testosterone. If a person has high SHBG levels, more of their testosterone will be bound to SHBG and less will be available as free testosterone. This can lead to low free testosterone levels, even though the person's total testosterone levels are normal. Bioavailable testosterone testing may be useful in some cases. For example, it may be useful for people who have high SHBG levels, as this can make it difficult to interpret total testosterone levels. Bioavailable testosterone testing may also be useful for people who are taking medications that can affect testosterone levels. What is supraphysiological testosterone levels? Supraphysiological testosterone levels are testosterone levels that are higher than what is naturally produced by the body. Supraphysiological testosterone levels can be achieved through the use of testosterone replacement therapy, TRT, or anabolic androgenic steroids, AAS. TRT is a treatment used to replace testosterone in men who have low testosterone levels due to a medical condition, such as hypogonadism. AAS are synthetic steroids that are used to enhance athletic performance and build muscle mass. Supraphysiological testosterone levels can have a number of effects on the body, both positive and negative. Some of the positive effects of supraphysiological testosterone levels include increased muscle mass, strength, and bone density. However, supraphysiological testosterone levels can also have a number of negative effects on the body. Some of the negative effects of supraphysiological testosterone levels include increased risk of heart disease, stroke, acne, hair loss, and liver damage. The risks far outweigh its benefits and is considered dangerous. What is the physiological level of testosterone? Physiologic testosterone levels are testosterone levels that are within the normal range for men. The normal range for testosterone levels in men is 280 and 1100 nanograms per deciliter. Physiologic testosterone levels can be achieved through natural testosterone production or through testosterone replacement therapy, TRT. Natural testosterone production is the process by which the body produces testosterone. Testosterone is produced in the testicles by Leydig cells. The amount of testosterone that is produced naturally varies from person to person. However, most men produce between 280 and 1100 nanograms of testosterone per deciliter of blood. On average, healthy young men produce about 5 to 10 milligrams of testosterone a day. In some men, testosterone levels remain high throughout life, but in most, they begin to decline at about age 40. However, this occurs in a pulsatile fashion. Natural production is increased in AM and gradually declines throughout the day. The pulsatile fashion of testosterone is driven by anterior pituitary hormones called luteinizing hormone and follicle-stimulating hormone. The negative feedback of LH, FSH, and testosterone is a complex process that helps to regulate the production and release of these hormones. Lowered levels of LH, FSH inhibit the production of testosterone in the testicles, resulting in a subsequent effect of lowered testosterone levels. Low testosterone levels stimulate the release of LH and FSH from the pituitary gland. This cycle repeats itself over and over again, helping to keep testosterone levels within a normal range. The negative feedback loop is important for maintaining normal testosterone levels and male reproductive function. If the negative feedback loop is disrupted, it can lead to a number of problems, including low testosterone levels, hypogonadism, infertility, and decreased sex drive. As a result, the pituitary gland may stop releasing LH and FSH, which can lead to low testosterone levels and infertility once TRT is discontinued. LH and FSH levels are virtually undetectable in an individual receiving TRT therapy. Testing for LH and FSH is very useful in determining whether the negative feedback loop has been disrupted. Men who are thinking about using TRT and want to keep their fertility may wish to have a semen analysis before starting treatment. It is also a good idea to see a fertility specialist before starting TRT. Studies have reported that more than 20% of men who stop TRT do not recover their sperm production.